inequalities between those who have a lot of, be it food, be it wealth or comfort, and those who are living in a poverty line, who are residents of the poor communities. So majority understood that we have to comply with the lockdown restrictions in theory, but practically, how do you do that when you do not have food at home? How do you do that when you are expected not to trade if you are an informal trader or you are informally employed, to go out and seek employment daily because that's how you get money? Or if you are doing your own business at home, selling some stuff or fast food, whatever form of income generating project that has sustained you. Lockdown has in a way enforced those people who are really struggling with something to eat to defy the restrictions and to go out and look for food, because one has to choose between sitting at home without anything to eat and going out and picking up or getting infected with COVID. So majority of the people who are poor were forced to go out and look for food, while those who are rich, lockdown meant sitting at home or buying enough food for themselves. They've got access to internet, they can work at home, so life for them still has a meaning. But for those who are really poor, it's meaningless, the fact that there is COVID, because people are dying and there's too much poverty.
So the first thing that we thought of when lockdown was announced, that our people are going to starve, because as you know, in South Africa there are so many unemployed people, and they usually would hustle through selling in the trains, through selling in different ways, but some would get money through friends giving them something. So once lockdown was announced, then they were told to sit down and isolate at home and stuff like that. So we knew that where would these people go to get food if they're told you can't be outside, you can't go to town, you can't go anywhere.
Yes, this lockdown issue, it was a top-down approach strategy, and it didn't work. It did, but not 100%, till we had to move to another level where the community came with a bottom-top approach strategy, where we had to meet each other somewhere. Then we were able to really come up with these good results.
No drugs, no food, no electricity. It was a recipe for disaster. And kids were running outside. And people were saying, what kind of mothers? They know it's in a epidemic, and they know this and they know that. I said, you know what is going on in a child's house. And the people are said to stay indoors. The kids are why? Because the conditions in the house is not nice for the child to be in. So it's better to play outside and to be inside. Because there's such fighting as mommy and daddy, they don't have drugs. You understand?
It's important to have social distance, but some people make a joke of it, but we don't comply. All over here in our area, they don't comply. Also with sports, on the sports field, that every weekend there's like illegal games happening, and you have over hundreds of people on the sports field. They break the locks.
And also the washing of hands. That was another challenge, because people that they will acquire, sometimes you make your own sanitizer that you must mix with jig, but people, they don't have such things. They need to buy such things. People now, they're no longer able to go and hustle and find work and everything. So I think it was also some of the things that I think was the challenge.
You want people to sanitize. How must I sanitize? I don't have money. Hand sanitizer. Okay then. Use soap and water. It's what I live in a windy house. We must get water. Access to running water to wash my hands. Social distancing. How can I social distance? We are 20 in the house. One of the person must be in quarantine. How can it be in quarantine? Where must the other 19 people sleep? I'm in the windy house. Where is social distance? It's just one big room in the windy house.
Oh, people are suffering. People are suffering. They don't have something to eat. They don't have work. They don't have. Most of people are unemployed.
The other issue also was the thing about this domestic violence. Women were getting beaten up. Found the cops. The police station is closed due to COVID. Cops infected with. So what do? There was a lot of information on social media. Phone this, phone that, phone that. I tell the woman, phone this, phone that. They're still waiting for the cops to come. We are now on level 2.
Since lockdown, gender-based violence is very high, because now the man is not at work. He's at home all the time. He sees everything that is going on in the house, and even he is stressing because there's no income now. So the woman is paying. So gender-based violence, many girls that were killed in our community by their boyfriends, by their husbands.
Saddest part was my husband is an engineer, he's a fit-time turner. He hasn't been working for 8 years because there's no work. He would just have a shutdown here and a shutdown there. And then he got the permanent job, and when they said lockdown, he lost his job. So it is difficult.
And for the traders it's very hard because they need to feed families. They have to rely on food parcels, which then some of them never receive. And it's very hard. And with COVID-19, that's even worse on them. Like some of them even went without electricity or water. They had to give up their residential where they stay to live with their children or something just to have food. As you can see in Kells River, our market, there's nobody. This used to be a very vibrant place. And now the tradings are mostly Fridays and Saturdays, and when people get paid. Unfortunately, that is how the situation is for us. And as you can see, my youngest son is here. He's supposed to go to college today, but unfortunately I can't afford to send him because there's no money for transportation. And because of COVID-19, as you know, lots of people were retrenched. So the market will then have to take in all these people. And because of taking all these people in, the market has shrunk. So there's not so much money flowing anymore. The majority of traders in Kells River are women. And these women must see to their children and their grandchildren. They must see to every day's living expenses. And it's very hard on them, as they don't have the means always to do these things. If they can't trade, they can't come to the market because there's money, no money to bring them here. Because most of the traders need to rely on public transport.
People would have died of not corona but starvation. So we wait. Corona, should I fear corona or should I fear the people?
You see that there is let's say the schools were closed. Eh? Now that the schools were closed, the kids are at home. You don't have food for these kids because they are at home. the whole day.
We started with food parcels. So we started with, I think, 50 food parcels that we gave to our neighbors, and we just saw that the need was just too much. And the way that we would fundraise for the food parcels, it took time to get to people. So we're like, okay, what is the best way? So my mom was a caterer, and that is what she was doing. And so we started a community kitchen, and after that she fostered 2 more community kitchens, and just a month after, we had 38 soup kitchens operating, feeding 4,300 people each and every day.
Especially African communities, the period that people are expected to mourn their loved ones who've passed on, how they are supposed to mourn them. Then there is a burial arrangement that people have to go through. We are Africans, so that coming together and mourning in our own cultural way help us to deal with those that have passed on or with the loss. So it's one of the things that came out very clearly, and these are some of the psychological scars of the COVID that we're going to experience for a very long time.
So we have to say these people need support. Need support in terms of the person goes into the Grooteskier hospital. Day 1, day 2, person is diagnosed with COVID-19. How that happened, we don't know. Day 3, the person is dead. The family members, obviously you can't go there, visitations at the hospital. Family members are traumatized.
Stressing in terms of e-healthcare facilities, just because most of the clinics were closed. The people, they sick and tired to go to the clinic with your appointment, but you didn't see a doctor, you didn't get your medication because of the restrictions of COVID. So now we are challenge of two people go back to the clinic as or back to care. They don't take a treatment, they stay at home just because they don't have a choice.
And then we had another challenge where the facility closed down because one of the staff became infected. So we didn't know where it come from. Was it the clients who infected the staff? Did the staff come from the different areas coming to infect each other at the facility? There was that type of uncertainty. So the clinic had to close down, and the clients who were TB patients had to go to Hanover Park and Heideveld for the medication, which obviously didn't go because they didn't have taxi fare to get there, and it's difficult for them to walk. So there was that added threat of people, if you're not on treatment, you can infect other people. So it was the COVID virus, and the TB could also, but TB infections could also increase.
On a Monday till Thursday, you can go buy alcohol. Friday, Saturday, Sunday is closed, which is actually a good thing, and I want the government to keep it that way. Even if we are no more COVID-19, I want them to keep it that way, because this will help us. Less accidents on the road, less people drinking, less people stabbing each other, because when they drunk, they fight. And our hospitals can't keep up with that, as well as with COVID. So yeah, that's one thing that I want to promote, is to keep it that way.
When it came to lockdown and alcohol was banned, wow, we were at peace with everything. At peace with our facilities no longer being overcrowded because of the cases that are influenced by alcohol. We were at peace because families were able to rebond again, and children were able to to really, you know, get things that they couldn't get at home. But that was for the first 2-3 months, I would say. Then people lost jobs, people were retrenched, people were no longer working, so people were just hustling outside.
I was standing here outside and I would call my husband and say, sure, look at this. How could the president even think of lifting the ban? Now the people is not going to have food anymore. And it's exactly what happens.
The issue of a mask, people are not wearing masks. Others carry them and forget them when they get into the taxi. Oh, driver, stop, I forgot my mask.
It's very difficult. I can't breathe through it because I have chronic sinusitis, and which means it messed up my whole system. In the beginning of lockdown, when I wore my mask, I went down with acute bronchitis because of the mask. And for 3 weeks I was very ill. And just a couple of weeks later I was fine and I got sick again because of wearing a mask. What government can't see is they force you to do these certain things. You know preventative measures. You know when to wear that mask or not. But they force you to do these things. We know it's for our own good, but there's also negative parts of this.
Because I'm a diabetic, right? The mask, it makes me sweat. I can't breathe properly. So I would, when I'm with my husband in the car going to the shops, I don't wear the mask. But if I have to go in somewhere, I will wear the mask. But unfortunately, I have to every time, you know, for the breathing. It's a must to wear it. It's for our own safety, our own health. But I cannot do with a mask.
This we had a sound system that we put up every day, and we did awareness, telling them this is the situation in the clinic, this is the situation with the feeding schemes, this is where you can go for meals. But Dangas is serving 2 o'clock at that spot, that one is serving 5 o'clock at that spot, this one is serving breakfast at, so it was sharing of information to the community so that people were up to date. Not everybody had a TV, not everybody was listening to the news, so they didn't have sources of information. So we were spreading that information every day so that people knew at least what was going on in the community.
And the surprising part was the partnership of our CANs and the whole Cape Town Together organization, where people that didn't have nothing, like myself, I had no prior experience, and I had no money to start doing what we were doing, but the partnership that we had all around and the collaboration that we had, be it donations, be it Seapoint Can, Seaboard Can, all the other cans coming together and just forming a solidarity and being there for each other, teaching each other, that was the surprising part that I never thought could happen. That is what lockdown did for us. The community should come up with their own solutions for the problems that they are facing, because they are living with the problems. We should stop having the top-down approach once helping the community. Solution should come from the communities and be supported the way that they want to be supported, because community know what they need, they know what they want, they know what they need. The whole community should be present when decisions are being made for them.
You look at the whole situation of COVID and you realize that the COVID once again has demonstrated the fact that government has not done enough to address the imbalances of those who are poor and those who are rich.